Hello, I am Dr. Khalilah Jefferson, DNP. Today, I would like to discuss the misuse of the emergency room. The emergency room isn't a waiting room, rethinking where we seek care. Let me start with a scene many healthcare providers know well. It's 2 o'clock in the morning in the emergency department. A trauma team is preparing for a critically ill patient. Ambulances are arriving. Monitors are beeping. And in the waiting room sits someone who has been dealing with back pain for 3 weeks, hoping tonight the emergency room will finally solve it. This situation plays out in hospitals across the country every single day. Emergency departments were designed for life threatening conditions: heart attacks, strokes, severe injuries, sudden illness. But increasingly, they're being used as something else: primary care, urgent care, and sometimes even convenience care. The problem isn't that people want help. The problem is that the healthcare system has made the emergency room one of the easiest doors to open. Unlike many clinics, the emergency department never closes. It doesn't require appointments. And under federal law, specifically the Emergency Medical Treatment and Labor Act, any patient who walks into an emergency department must be evaluated and stabilized regardless of their ability to pay. That law protects patients in crisis. But it also means the emergency room has become a safety net for gaps throughout the entire healthcare system. Long waits for primary care appointments, limited after hours care, barriers to insurance, transportation challenges. So when someone has a fever, a cough, or chronic pain that has worsened overnight, the emergency department becomes the most accessible option. But here's the challenge: emergency departments are built for immediate stabilization, not long term management. They can treat the symptom, but they often can't provide the follow up care needed to address the root cause. And when emergency rooms become crowded with non emergency conditions, something important happens. Wait times increase, resources become stretched, and the patients experiencing true emergencies, heart attacks, strokes, severe infections, face delays in care. So, how do we fix this? The solution isn't blaming patients. People seek care where care is available. Instead, we need to close the gap between access and awareness. First, we expand access to primary care and urgent care, especially evenings and weekends. Second, we improve health education so patients understand when a condition truly requires emergency care. And third, we strengthen community based care systems that provide ongoing relationships with healthcare providers. Because the best healthcare doesn't happen in crisis mode, it happens through prevention, continuity, and trust. The emergency room will always play a critical role in saving lives. But when the emergency room becomes the front door for everyday healthcare, it's a signal that the rest of the system needs attention. When we build stronger pathways to primary and urgent care, we allow emergency departments to do what they were designed to do best: save lives when every second matters. Thank you.